I signed up to My Health Record because I feel it's really important. I'm single and I live alone and I have chronic diseases, so it's really important for me to have that information available should I present to emergency or whatever, that they can have access to everything.
I work with My Health Record every day in private practice. When we write a letter back to the GP or to anywhere really about a patient, if it's clinically relevant, it's very easy for me to upload it to My Health Record. Our practice software has a tick box, you tick the box, you press send and it's done. The other main feature I personally find most useful in My Health Record is the discharge summary under the documentation tab, where people are often going in and out of hospital, particularly older people. Being able to access that instantly has changed my practice for the better.
As medical specialists, a lot of what we do really depends on information. So most of that comes from the patient, but more and more what we're seeing is we need to get information from other sources. So that can be primary care, it could be the tertiary hospital system, and often it's pathology providers, radiology providers. My Health Record being integrated into our practice was something that everyone was asking for. This actually came from the admin staff first because they spent a lot of time trying to chase reports, discharge summaries, letters, other types of results when we'd ask them to. And it would take them hours and hours and hours to try and track down the scan to try and help the patient.
One of my favourite features when using My Health Record is looking at the list of recently prescribed or dispensed medications. You can access a list of what a person has been prescribed and dispensed by a pharmacy and where that pharmacy is over the last 1 to 2 years. We now work in an environment where there is a lot of information being collected for our patients from various different sources. As doctors, we can no longer rely on simply our memories and the history of the person in front of us, particularly not with older people who may have memory and thinking issues. We need to be able to aggregate the information collected about our patients and be able to access it quickly in order to safely take care of them now.
What I hope to see as the months and the years roll on is that more and more people, especially specialists, start to upload the information to My Health Record, because one of the biggest gaps, in my practice is being able to understand what other specialists are thinking when my patient goes to see them.